Good morning, this is Dr. Cartwright, and just want to check in and share with y'all a new program we have here at the office, our 5-point knee restoration program. And just a little bit about knee and knee health. Our thigh bone is on top of our shin bone when it comes to the knee, kind of like in this photo here. In an ideal world, the thigh bone should line up with your shin bone, and that meniscus between, which is the cushion for the knee, should be nice and level. But what happens, how osteoarthritis develops in the knee, is basically those bones get out of alignment, and that starts wearing down on that joint. And it happens in stages, so it's like any other osteoarthritis in the body. And it goes through 4 different stages. In stage 3 is where you actually start seeing bone on bone with people. And as you can see, the bone gets real white because the bone is literally sitting on the other bone. And so often though, where we have new patients come in and they're told they're bone on bone, but in reality they're in one of these first 2 phases. In fact, this is a patient we started working with here recently, and this gentleman, honestly, he's in his 50s and can barely walk, in a lot of pain, and he was told a couple times he's bone on bone, but they never actually showed him his x-rays. But we got a chance to just take some films, and we showed him his films, and you can clearly see there's plenty of meniscus left in between his joints there. And so what our program does is a combination of adjustments in our new knee traction device and some other therapies, which basically helps gently but firmly separate the knee joint in a small distance to help reduce inflammation, increase blood flow, and also with the adjustments that helps restore alignment to the knee. And we're seeing 50 plus degrees improvement in range of motion with just one treatment with people. People that can barely lift their leg and they can walk out of here, which is really amazing actually, and we're so happy to have it in the community. So we're going to show you how the machine works here. And we have Cindy have a thigh strap that is supporting her, but it's not very tight. I have a lower leg cuff, which also helps support the other side of the knee. And basically that allows this joint to be tractioned. And here, I'll just turn the device on so you can see how it works. And basically it has a steady, but gentle, right, Cindy? It's not painful at all. A steady traction on the knee, which, like I said before, it helps improve circulation, decrease inflammation, and it helps kind of retrain the muscles, ligaments, nerves around the joint to create more strength and stability and improve range of motion. And in fact, Cindy, if you mind sharing a little bit about your experience with the machine, because she's actually been using it. And
yes, I injured my knee and twisted it really bad, and I'm not a painful person. I can tolerate pain pretty good. But once we did this, we did it several different times, and with the adjustments, the next day I was walking wonderful and there was no pain.
Yeah,
it's amazing.
Yeah, like I said, we're seeing amazing results with patients and very quick results. And in fact, just don't take our word for it. We're going to share a testimony with one of our satisfied patients.
Hi, my name is Karen, and I've been seeing Dr. Cartwright and his ladies here since March of 2012, right after I had my second back surgery. And now that he has this new knee traction equipment, I've had knee surgery in the last 2 years, and this has really helped me a lot in my mobility and also with my RA, especially with the joint pain that I've been having with my knees. When I get done with the traction here, I'm able to walk better. And so I just keep coming back because every day I come is a better day for me to make my life sustainable and longer, that I can stay on my own 2 feet and not in a wheelchair. Thank you.
Thank you, Ms. Karen. That was one of our satisfied patients. And thanks to also whoever's watching this for taking the time to let us help us educate you on knee health. And if you feel like this is something that might be beneficial to you or someone that you know, we encourage you to call our office and let us see if we can help you like we've helped many others.